Okay, so I am going to be doing my physical assessment today on my patient here. I'm checking the doctor's order and making sure I have the patient that I need. I'm gathering all my supplies and I'm performing hand hygiene. And then I'm gelling in the room after I knock. Can I come in? Okay, gel in. Hi, I'm the student nurse today. My name is Ashton. Can I do a physical assessment on you?
Sure.
Can you tell me your name and date of birth, please?
Travis, 52979.
Last name?
McSherry.
And I check his identiband. It is, yep, matching. So I'm gonna go ahead and provide privacy. Are you experiencing any pain?
Yes, having a headache.
How painful is it on a scale of 1 to 10?
3.
A 3, okay. Is it throbbing? Is it dull?
Just dull.
How long have you had it?
30 minutes.
Do you want any pain meds for it?
No, it's fine.
Okay. Other than that, how things been?
Good.
Okay. So I'm gonna go ahead, if the patient's on a bed, raise the bed to working height, check that the brakes are locked. So I'm gonna start with listening to the patient's breathing. I'm just gonna listen to your breathing, okay?
Okay.
Every time I move my stethoscope, go ahead and take a deep breath for me, in and out of your mouth, okay? Breathe in. Good, you're doing good. And a breath. Can I listen to the sounds on your back too?
Sure.
Same thing, 6 different times. Okay, and at this point, would be a good time for me to notice the patient's skin, if they have any sores. The scapula and the back of the head, back of the ears is a common place to have that. Also, if I can get a look at the sacrum area and do that now and check if there's any sores. I'm noticing any tattoos. Is the skin moisturized? Do they need lotion? Any scars, bruises, swelling, mass, lesions, temperature. When was your last bowel movement?
This morning.
This morning. Was it normal? Was it diarrhea, large, moderate?
It was normal.
Okay, and how has your urine output been?
It's been good.
How about the color?
Just clear.
Smell, normal?
No, normal.
Clarity?
Yeah.
So at this point, I'm taking note if they have a Foley catheter, and if they do, then I'm noting the output of the catheter, how much, the clarity, the color and the odor. I'm noticing is the patient on any liters of oxygen. The patient is not. Have you been having any dizziness?
No.
You've been able to get out of bed well, not easily, I mean, you're in the hospital, but just fine, right?
Yep.
And therapy's been going okay?
Yes.
I might notice something like they have a front wheel walker or a cane that they use for assistance. I'm just gonna go ahead and feel your pulses here. Okay, I'm noticing that their rhythm quality, they're even. If the patient has any kind of IV site, I'm just checking to make sure there's no redness, swelling, or pain. If they have any dressings, I'm noticing if they need to be changed and that they're not saturated or anything. The elbows is the area that I'm looking at for sores. I'm noticing any tattoos in this area. How's the skin? I'm just gonna go ahead and check your face symmetry now. Go ahead and lift your eyebrows for me. I don't know if you can take off your mask or you want to take off your mask. To just show me, okay, yeah, your smile, can you stick out your tongue for me?
It's out.
Okay, and I'm checking to see the condition of the teeth. How are the mucous membranes in the mouth? How are the lips? Are they chapped? Does he seem dehydrated? I'm checking to now look at the eyes. So I'm just gonna go ahead and shine my light. I'm checking for his pupils being equal, round, reactive to light. And I'm shining on both sides. His pupils were already pretty constricted actually, but they do appear even and reactive to light. Go ahead and just follow my pen light. Good, I'm bringing it closer. And so his eyes are able to adjust to that, good. Since I'm here by the head, I'm noticing the hair. Is there any baldness? How's the distribution? I can at this point check for lice. Is there any excessive dandruff or maybe psoriasis on the scalp? Hygiene, does the patient need maybe a shower by the aide? Okay, so at this point I'm gonna go ahead and tell the patient that I'm monitoring their radial pulse, but I'm actually looking at their respirations. So, yep, noticing that. Go ahead and put your arm down. Inspecting and palpating as I go. How's the temperature? At this point, I can actually take the temperature. I could take his oxygen saturation levels. I could take the blood pressure. So I would do that. And then at this point, I want to go ahead and listen to the bowel sounds. So I'll start with the right lower quadrant, move to the right upper quadrant, then left upper, and then left lower, making sure I hear a bowel sound for each quadrant. So I shall do that now. And then that would be a time that I oscillate before I palpate, but now I can palpate. And let me know if you feel any pain.
No pain.
Okay, so from this point I can go ahead and I want to listen to the apical pulse now, so I'm just going to be demonstrating how I would do that. I don't have time to do it for a full minute right now, but here we go. Okay, the heart sounds okay. So, how has your mood been? Have you been feeling down or hopeless or anything?
No, I'm good.
Talking to family members?
Yeah.
So I'm also taking note that the patient can follow directions. So I'm gonna give you 2 of my fingers. Go ahead and grip them for me. Okay, good. I'm giving my hands, push back. Good, so both his arms are even with strength and able to do that. At this point, I can notice the fingernails of the patient and the contour. Are they that 160 degrees that I want them to be? I'm noticing the texture. I'm checking the capillary refill, which looks fine, seems fine. I'm also gonna check the skin turgor. So his clavicle right there. He's hydrated. And I'm noticing any kind of jugular vein distension. Earlier also I wanted to mention that I taking note of the patient's abdominal area. Is it concave? Is it distended? Is it rounded? And I'm also comparing their AP diameter to their transverse line, making sure that the patient isn't barrel chested. Now at this point I can go ahead and check the legs. So I'm just looking at the calves here. I'm noticing if maybe one has edema and one doesn't. They both seem okay to me. The patient's shoes are off, and I'm checking pedal pulses. And, huh?
Got a good feel.
Yeah, so they both are, I'm checking the rhythm and quality. Are they equal? Are they weak? Is it bounding? They seem regular. I'm noticing any edema of the feet. And if there is edema, I'm grading it from a +1 to +4 scale. And I'm noticing the heels and the skin integrity of the heels, if there's any skin breakdown happening there. Can you go ahead and show me that your feet can point? Okay, and go ahead and, good. So I'm checking the dorsiflexion and plantar flexion of the patient, which seem good. I can also take notice of their toenails here, make sure that there's no clubbing of the nails going on with the feet. And I did want to ask one more thing. We checked disposition. Yes. I'm just making sure in my head that I went over everything, as I cannot redo this a third time. And legs, feet. Yeah, like I said, I would just make sure to check the problematic areas for sores, like the scapula, greater trochanter, the iliac crest. That's why the greater trochanter, the scapula, the sacrum, and the heels. And I'm inspecting and palpating the legs as well for any kind of mass, swelling, sores, lesions. And then I can return the patient to a comfortable position and put their bed in the lowest position with the brakes locked. I'm putting the call light by the patient. Is there anything that you need that I can get for you? Press your call light if you need anything. And if you do decide you want pain meds, just call and let me know.
Okay.
And so at this point I remember my one last thing. Okay, so the last thing, sorry sir, that I want you to show me is just that you can flex your arm, extend your arm, and that you can show me pronation, which is like this, and then supination. And they seem like they're good with that. So at this point I'll leave the room. I would gel out, then leave the room. And I document my vitals, the patient's tolerance, just any kind of findings, abnormalities, and that is all. Thank you.